Okay. So you were telling me about, all right. If you look at the image over here, can you please help me and identify all these structures from A to F, please?
Okay, ma'am. So A
Yes.
seems like biceps brachii.
Okay.
Yeah.
And then
B is median nerve.
and
Then
C.
C is ulnar nerve.
All right. And D, please.
D is musculocutaneous nerve.
Okay. E, please.
E axillary nerve.
Okay.
And
And F.
F posterior cord. Maybe no, is
So if
yeah,
you
is
tell,
either a radial nerve or posterior cord. Yes, I think
okay,
it's a radial nerve. Yeah.
wait, it's the median nerve root of, because see here it's
Yeah,
going,
F is a radial nerve.
if
It
it's,
came from the posterior
yes.
cord. Yes.
Okay, right. Can you please tell me the branches, the cords, they give how many branches?
Okay, so like from lateral cord, it gives musculocutaneous nerve and lateral pectoral nerve and lateral root of median nerve. From posterior cord, it gives upper and lower suprascapular nerve to the latissimus dorsi, and axillary nerve and radial nerve. And from the medial cord, it gives medial pectoral nerve and medial cutaneous nerve of arm, medial cutaneous nerve of forearm,
Yes.
and ulnar nerve.
Right. Can you tell me what are the injuries that you can suspect from the pull of the arm? If someone falls on outstretched hand, what are the kind of injuries that can occur as a result of it?
So the most common one is upper trunk injury, which
Yes.
caused arch paralysis,
Yes.
and sometimes it's
Yes.
caused lower trunk paralysis.
How would
which
a
calls
patient present with arch paralysis?
Okay, so in arch paralysis, you will find a waiter hand deformity, which
Yes.
is caused like abducted abducted arm and internally rotated arm and extension of forearm.
Okay.
Sensory
And
loss will
there'll be sensory loss of
loss will be
arm
lateral
and forearm.
part of the arm and forearm.
Yes, radial side of the arm and forearm. Good. Can you please tell me how the shoulder girdle is formed?
Okay, so shoulder girdle is formed with the union of scapula and the head of the humerus.
Okay.
So,
What are the structures which strengthen the shoulder joint?
so it is strengthened by shoulder joint is strengthened by mainly rotator cuff muscle and is weakened due to the shallow cavity, and
And?
there is a axillary recess due to the quadrangular space on the inferior part.
Okay. And
less ligamentum joint.
yes, there are ligaments and there are other muscles as well. What are the muscles which form the rotator cuff?
So there are four muscles:
Yes.
supraspinatus, infraspinatus, teres minor, and subscapularis.
Yes. Kindly tell me the origin and insertion and nerve supply action of teres minor, please.
Okay, so teres minor is originated from the lateral border of the scapula and inserted into the greater tuberosity and is supplied by axillary nerve.
Okay, very good. And the action?
Action itself is causing medial rotation and adduction of the shoulder joint.
Can you please tell me what is this 11?
So 11 is subscapular is fossa, subscapular fossa of scapula.
What is 2, please? What attaches
Is
here?
acromion process. So
okay, we can come back to that later.
Yeah.
15, please.
15 supraspinous fossa.
Yes, 5, please.
5 is infraspinous fossa.
What attaches here?
Is infraspinatus muscle.
Okay, can you tell me by looking at this image or any image that you want in this picture A, B, C, Where exactly quadrangular space is located, and what are the boundaries and contents of quadrangular space?
Okay, so quadrangular space is located just inferior part of the shoulder joint, just below the infraglenoid tubercle. So
Yes.
is bounded laterally by the humerus, medially by the long head of tricep, and superiorly by the teres minor and inferiorly by the teres major.
And the second part of the question, contents of the quadrangular
Contents
space.
is axillary nerve and posterior circumflex humeral artery.
Okay, what are the factors which decrease the stability of the shoulder joint?
Is a shallow cavity of the glenoid labrum,
Yes.
and that quadrangular space for the axillary recess in the inferior part, and less ligamentum joint.
Lex capsule as well in the
Yes,
inferior.
less capsule and ligament. Yes.
Okay, right. Can you tell me what type of joint is shoulder joint?
Is a ball and socket type of synovial joint.
All right, good. Can you please first identify the image and then identify the marked structures, please?
Yes, so this is a image of MRI of shoulder joint.
Okay, MR arthrogram, yes.
So number
What do you
4 is
see in-
clavicle, number 1 is acromion process,
Okay,
and then number 5 is deltoid muscle,
yes. 6, pointing
6
at,
is the glenoid cavity,
yes. 7.
7 is glenoid labrum.
Can you please quickly, last question, what are the indications when you would ask for this kind of image? Bell vent.
Okay, maybe shoulder dislocation or any suspected ligamentum or muscle injury.
Okay. Right. Okay, thank you.